Thank you everyone for making the time for DHAKA questions. So I would like to first of all request you to introduce yourselves, and then we'll get on with a few basic questions, very informally. So that's.
Start off with yourself.
I'm the person who formed this group called DHAKA Questions, and part of the objective is to focus on different problems and raise awareness. So with that, I would ask Sadi Bhai and Sonia Apu and Anis Bhai to introduce each other. I'll start with Sonia Apu.
Okay. Thank you for taking this very big initiative in doing such a good awareness program for everyone. I'm Dr. Sonia Nasreen Ahmed, and I'm currently working as an assistant professor of medicine at Holy Family Red Crescent Medical College Hospital. And yes, basically that's it.
Thank you.
And thank you, first of all. And I'm Dr. Kaji Mohammad Ansudjaman. I'm working as a cardiologist, senior consultant in Khulna City Medical College Hospital.
Thank you, Anis Bhai.
And I'm Dr. Mirsad Ahmed. I am an emergency medicine consultant. I can probably bring a little bit of international flavour, having worked in the COVID outbreak in the UK and seeing what the response is in Bangladesh. So I'll defer to Sonia about the hospital setting response in Dhaka, and I'd probably be best talking about international aspects given my sort of global health and public health background.
So I've just heard you mention COVID. So I'll just ask, what is this COVID-19? I mean, we're hearing there's a lot of information out there. I think people do know what it is, but it'll be useful to hear it from you. What is COVID-19, and what would you say are the symptoms of someone being infected by the COVID-19 virus?
So COVID-19, the word itself signifies a disease. Just like we have a disease like pneumonia, a disease like tuberculosis, these are all infective diseases. COVID-19 is a disease. It is caused by an organism, a virus, and that virus is part of the greater coronavirus family. And that virus has a name itself, which, correct me if I'm wrong, is SARS-CoV-2.
SARS-CoV-2. And I'll just add in over here, like when we said that the name COVID, it comes if you break it down, it comes like CO is from corona, VI is from virus, and D is for disease. So it's COVID, and 19 is like when the year it was when it started.
Well, thank you for explaining that to us. And what would you say are the symptoms? Because there's lots of questions about the symptoms of COVID-19, and how would one distinguish it from a common cold or common flu?
So what I would say right now, it is a coronavirus. It will have symptoms that are similar to a lot of coronaviruses. However, since it is, as they say, a novel disease, a new disease, we don't know, or we will not know, all of the symptoms at this early stage. But saying that, there are the general symptoms of any disease that you have as a viral infection, which will be fever, or temperature, it will be headache, it can be a cough. Particularly in this case, what everyone is saying is a dry cough as opposed to a productive cough. You might not have that classical runny nose. However, again, if you do have a runny nose, it doesn't mean you don't have COVID.
Right. So that's really useful to know. But let's say for young people who are who are living indoors in relatively close spaces, what is your advice to someone who started to feel the symptoms of a common cold or a flu? Like there are lots of concerns that
Sonia, do you want to take that?
Yeah. So, like we said, like the common cold is also caused by a coronavirus.
Right.
And COVID-19 is also caused by coronavirus. So hence they will share some properties. And as such, it's the common symptoms like raised temperature, cough, maybe runny nose, sneezing. These will all be the same for both parties. So how do you know if you have it, if you've got the common cold, or do you have COVID-19? Very difficult to say at the moment. But given the fact that it's become a pandemic, that's why the best thing that's been given worldwide, because of the instead of overburdening the healthcare system, is we recommend people that if you have these symptoms, then just self-isolate or quarantine yourself at home for 14 days so far. And doing that is hard.
Right.
It is hard, and like you said, that for the young population, how will they do it when you have so many people at home as well?
Right.
Ideal setting is that you have your own room with your own bathroom.
Right.
Ideal, not
Right.
feasible, right?
Right.
So what are you going to do? At least, if like we say in these times for the normal people, we try to keep at least 3 feet of a distance between one another. I don't know if have we got 3 feet yet.
Not
So,
yet,
not
but I
yet, but
think
hopefully, okay.
we'll have to,
They don't. It seems. But if you are affected or you have those symptoms, you keep at least 6 feet distance from your household members, and that should be, plausible. You should be able to do that. Do not share your personal items, utensils, plates, and glasses with your, with your household members.
Right.
Can I just ask, I mean, like, what you're saying
Yeah.
is more DHAKA based.
DHAKA based,
Yeah.
exactly.
So I is working also in a city in Khulna, but would you be seeing, or have you seen any cases in Khulna coming in from the villages or the rural areas?
Actually, not yet. Although my field is a bit different,
Different, yeah.
I'm working with heart patients. But still, so far, in my hospital, it's a 250-bedded hospital. So far, I know that a lot of patients are coming with running nose or sneezing,
Right.
these symptoms to the doctors, but they are not yet identified whether they have coronavirus or not, and still I think there is no tools
I was
to
gonna ask you that.
Exactly.
diagnose in outside Dhaka.
I mean, it's
And-
already
and-
burdened within Dhaka as it is, so.
I mean, we are also hearing that a lot of people are have started to go outside Dhaka, different villages.
Mm.
How, like, do you think our health system is prepared to handle that at this point, or like, we have the basics?
A very controversial issue now.
Uh, yeah,
Well, no,
so-
from
so-
a medical
But,
medical
I think
doctor's
I
point.
think it's a very highly populated country,
Right.
Bangladesh, and our resources, health sector, our resources very limited
Right.
compared to other Western countries.
That's right.
So even the Western countries are struggling to
Yeah.
deal with this
Exactly.
with these things. So it will be very difficult for our healthcare system to deal with these things. First of all, because we are not yet sure how to deal with this, how to
Right.
contain this virus.
Right.
So I think our goal will be to as much we can minimize the number of affected people.
Right.
We will not be able to completely eradicate the
No.
things, but as much
Prevention,
as we
yeah.
can with general knowledge and consciousness
Right.
Awareness.
and awareness program. It will not be very possible for the government alone
Absolutely.
to completely
I think it's like
tackle
we,
this situation.
We all need to be socially aware. It's like what they said, that if you want the country and the government to be responsible, we should be responsible citizens first.
Ourselves, yeah.
So I'll probably add to that over here. So there are two elements to this. There is the treatment of COVID-19, and then there is the management of the pandemic. Now, from what little we know of COVID-19, yes, people will be saying that it is like any other viral infection. Its case fatality rate, we'll be talking about that in a bit, is probably not as high as influenza. The infectivity is probably not as bad as measles, so it's pretty low down on the spectrum.
Right.
And so we shouldn't be too scared. We've had that phase of people saying don't panic about COVID, and that's a fact. Yes, you don't panic about the disease, but again, we'll have to say it's quite early on.
Exactly, that's what I was just
Yeah.
going to say. It's too early to say don't panic,
Yeah.
but then again, we just can't get everyone being panic and buying out sanitizers and masks and
Right.
not leaving things for
So
other people.
The management is going to be the standard management of how you manage flu, how you manage any other infections. But we still have to be a little bit more cautious than
Exactly.
we normally would be.
Sorry, on that point, because being cautious or not being scared or being scared. Now, currently we are here getting a lot of information from a lot of different people and everyone trying to help, right? But then at times we're hearing people saying that if you got fever, if you have cold, then rush to the hospitals or call that hotline. But the hotline may not work at all times, so would it be wise for everyone to rush to the hospital? What would you recommend would be the right thing to do And I would follow it up with another question, but I'll let you answer that first.
So, again, because it's such a novel disease, it's
Right.
a tricky question to answer.
Yeah.
However, what we can do is go on what existing evidence we have.
Right.
So, if I come down with a flu, a fever, the common cold, we've all come down with it, right?
Yeah.
At one stage in our life, we've all come down with the flu. Have we all rushed to the hospital with the flu? No,
Right.
right? So we all have some sort of experience with how to deal with the flu. I will get a temperature, my heart rate will go up, I will have a sore throat, I will have a headache, right? I will take medication for that. I can take paracetamol, I can stay hydrated, I can take antihistamines like I normally do. Once this disease starts going outside this normal pattern that we're familiar with,
Right.
that would be the time I suggest people get some expert advice or an opinion.
Exactly.
On that,
Yeah.
Sonyapu, I would also ask you, like you've dealt with the whole dengue situation in
Yeah.
the city early on. How would one know when it's an emergency situation? That's the question for all of you, actually.
Right. So, interestingly enough, that dengue also has initial symptoms that are similar to COVID-19 as well.
Right.
Again, headache, high temperature, runny
Right.
nose as well.
Right.
We had a lot of these cases. So,
What you've also got to remember is dengue is also a viral disease.
Right.
right.
Okay.
And given this, like this is now March, we're going to enter April as well. This is now going to be the peak seasons.
Mm.
Like just like last year during this time, we were flooded with dengue patients.
Right.
It just started from February or March. So you rightly said that. How do I know what I'm dealing with?
Mm.
Very difficult. But most important is all viruses, same thing. Paracetamol. Take the antihistamines for those blocked noses and the cough. Take an anti-ulcerant and stay hydrated. Need to stay hydrated because obviously for COVID-19 as well, you will stay hydrated, but for dengue, it's very, very important
Important for you to
to stay hydrated as well. But like Saad said, is that if it just goes beyond the normal pattern of a flu, you must have that red flag signal in your head that, okay, something could
Right.
be wrong. I must go to the doctor. Then very tricky times. It must
That
be
doesn't
very
make it
tricky
an
times.
emergency.
Yeah.
Right.
Now, when it starts getting worrying
Mm.
is like if you start having symptoms of confusion.
Symptoms of confusion.
Confusion.
Okay.
Drowsiness, unusual drowsiness.
Right.
If you have a fever that's not settling down
Right.
After
with
7
some
days.
paracetamol,
Right.
right? Right. So it's unlikely that a fever will persist through the paracetamol dose.
Mm.
You can have recurrence of the fever after the paracetamol wears off.
Right.
That's fine. But if it's
Stays the
stays
same.
there, or if you've had it for 5 to 7 days
Mm.
and the severity hasn't diminished,
Mm.
those are the times when you think that yes, you need to get a
Also,
check.
I'll add to that as well that if you start feeling short of breath, so that's very subjective when you say, okay, but without panicking, but you really are finding difficulty in breathing, your chest is becoming tight.
That's
you should
not
get
normally
that.
what happens
Right.
with
In
a
a viral
normal
fever,
flu.
you get body ache basically, right? You're having a headache,
Yeah.
body ache, and you're not
You feel
feeling
tired.
You're feeling tired.
Yeah.
But anything beyond the norm, you're struggling to breathe.
Mm.
Should strike you.
Would there be any changes in your physiology, like the heart rate could go up, or
So
like,
heart rate
I'm
will
looking
go
for
up.
red flags,
Yeah,
basically.
so heart rate will go up. This is what we just mentioned before, that when you have a fever, when you have a pathogen in you,
Yeah.
your body will host a response
Right.
to try and neutralize that.
Right.
So your body's working overtime.
Right.
That's why you develop the fever, that's why you develop the tachycardia,
Mm.
which is another word for a faster heart rate.
Right.
You probably will be breathing a little bit faster.
Mm-hmm.
When you start breathing a lot faster, when your blood pressure starts dropping, that means if you start having dizzy spells,
Mm-hmm.
these are the times that you need to be a little bit more careful and say that I probably need a little bit more support. But what Sonia said about the shortness of breath,
Mm-hmm.
if in particular you have, we're not talking about asthma, we're not talking about a viral wheeze, which a lot of people can have
Right.
when they have an infection, but from what we've seen or what we've understood of COVID-19 is it does affect the lungs.
Right.
So you do get an atypical pneumonia.
And it's very important for us to be aware of that, because when we have flu, we are aware of that. Like we are weak, we are tired, but an emergency situation would actually know that it's an emergency.
It would be different.
It would be much different from, because I think that's something very important for normal, general people to know, to differentiate when would be the right
I'd
time?
like to just add something over here, is that also that, like we're all obviously very worried about our, loved ones, especially
Right.
the elderly who are
Exactly.
at home. So, most of the elderly population, our parents and grandparents, they're having one or two of the either diabetes or raised blood pressure, hypertension, and things like that. So during this time as well, whether it is dengue, whether it is COVID-19, because of the possible complications that can affect more of the elderly population that has been seen so far,
Right.
I'd say that it would be very wise during this time as well, if they have that fever, to monitor the blood pressure as well. That can be
Right.
another red flag. If you see that a person who has a certain blood pressure and now is just falling, despite
of-
that, you don't find anything else obvious that's that's a bit worrying.
Okay.
Can I add
Yeah.
one
Yes,
thing?
please.
So when this is for Dr. Soni and Sadi, because they are more expert with this diseases. So whenever a patient is feeling those red flag signs like disease pain or shortness of breath, so where they should go
Right.
to seek help?
Yeah.
That
Yeah.
is a very
That's a
basic
very,
question,
very important
because
question.
not all the hospitals are dealing with these things.
Right.
Not all the hospitals have separate corner for dealing with these things
Right.
yet.
Right.
Yeah.
So where they should go,
Mhm.
that is one thing.
Yeah.
And in so far I know there are 6 hospitals in
Yeah.
Dhaka, but I think there should be more organized system, and there should be awareness that where
Where should the
one
patients
should
go?
go.
I
the
mean,
patient should go
it-
from the media and other things.
Right.
I think it can come from our authority and our
Yeah.
responsible
it's
person.
it's so difficult to answer that question as well, because whereas the patients having those symptoms, which may or may not be this COVID-19, they need a place to go. At the same time, as doctors, we also have to worry about our own personal safety as well.
Right.
Because if we are exposed, I go home, my mom, my husband, my child,
Right,
they will
exactly.
be exposed. So we have that,
You have that worry as well.
Unfortunately, we don't have those kind of protective gears, and I have
Right.
to say that we don't.
Right.
But the valid question is, if I think about it, because I always try to think in that sense, that if it's me or my loved one who's sick, where do I go?
Mhm.
Okay, we have probably an added advantage. We can monitor them at home.
That is
but
what we
then,
can
then God forbid, it becomes worse. What, should I run to those 6 hospitals? Or could it, that is designated for COVID-19? Or maybe this might not be COVID-19, it could be a dengue case,
Something
but how will
else,
I
yeah.
differentiate it?
That is the-
Right, this is for the normal, common
Yeah,
person,
that
right,
is
who
the
hasn't done the test or
difficult
anything
thing,
like that.
yeah.
We're at a loss, honestly speaking.
Mm.
So, but I would say yes. You've passed. You've had the symptoms. At least if you know that you've been at home for 7 days or 10 days plus, right? And you're not getting better. I think you just go to any hospital. If you can't go to those 6 hospitals,
Yeah.
because we have to use our common sense. I'm
Exactly.
over here. I might not be able to go to Kuwait
Right.
Mukri or
Right.
the other 5 that I mentioned,
Right.
right? Or someone who's in Khulna, someone who's in Sylhet.
Yeah.
What will they
Exactly.
do? Right. So you just go to a hospital, honestly.
That's
So-
part of the reason why
Yeah.
I'm asking this question, because then what would happen is, if you know when it's an emergency situation, then and only then you decide to go to the hospital.
Exactly.
Then you make that space for people who actually need that
So it's like what you
support.
said in the beginning, don't panic. When
Exactly.
you're at those first 7 days
Right.
of the viral fever,
Right.
stay at home and take a rest.
Right.
Don't overburden the
What I'd
doctors
say is that, again, from what we've seen in all humanitarian crises, this effectively is a disaster scenario,
Right.
a pandemic across the world. And in the first stages of a disaster, when it's the emergency response, there are no right or wrong answers.
Right.
Right? You have to deal with the burden of disease with whatever resources you have.
Yeah.
Right? No matter how well prepared or ill prepared you are.
Mhm.
Okay? And that's a fact. Right? And it's only from these disasters do we learn how to prepare for the next.
Right. That's
So in this state, this is probably the first pandemic this generation has seen, or the last 2-3 generations have
That's
seen.
right.
You've seen on Facebook and all social media about the Spanish flu.
Yeah.
Then
Those
that's
were
in 1912.
way-
Then
yeah.
you've had 1812. And then you've got 1712 or
Like
1718.
one in 100 years,
Yeah,
that
one
they
every 100
say.
years. But it's a once or in every 2-3 generations you'll have this. What I'd say from a patient's point of view,
yeah.
forget about how well prepared your health service are.
Mhm.
From a patient's point of view, what are you going to do? If you're relatively well, when I say that, you are not you're not confused, or your patient
Not having those so-called
those
red flags so
symptoms.
far, yeah.
If you think that you have COVID-19 and you think you need medical help,
Mhm.
then you go to one of these 5 or 6 hospitals that have been set up.
Right.
But then,
If-
when you
if-
say that, if you think you have COVID-19,
Yeah.
anyone will
Yeah.
think now. That's the
Yeah,
problem.
and that's fine. That's
Yeah.
what the health setup at this stage is. These 5 or 6 hospitals. You do not overburden any other hospital. You overburden these hospitals.
These hospitals. Yeah.
Okay. If you have an emergency situation in which you or your patient who you're attending
Mhm.
is very unwell, you go to any hospital
Mm.
as an emergency, right?
Right.
Because it might be COVID, it might not be. It might be any other health condition.
Right.
But when you do get there, then you need to liaise or speak to the people, say that possibly a case of COVID, or this is there's been no temperature. I don't think this is a case of COVID.
But it's still
That
an
health,
emergency.
that health authority, that health facility will have to do whatever they're prepared to do.
Right.
If they think that they can deal with it there, they
Mm.
deal with it there. If they think that no, they cannot deal with it, they'll need to transfer the patient or yourself to another organization. They will do that.
Mhm.
It is within medical ethics for them to do the bare minimum for life-saving treatment before they do that.
Right.
Okay.
Right.
So whether you need an IV line setup and then a quick transfer, or no interventions and a quick transfer, that needs to be done.
That's part of the medical.
That's
ethics.
part of the medical.
Well, that's, I mean, then again, we say that's part of the medical ethics. That is true, but like I said again, that if I was in the emergency department and I'm the doctor of that, thinking
Mm.
that this is a bad case, would I want to go and do any of those kind of interventions? Because
Mm.
I'm worried.
Mm.
Because we know that it's not just an aerosolized or droplet infection, it's also that, it can stay on your clothes,
Right.
it can stay on steel, it can stay on copper, even up to 3 days we've seen
Right.
that it can stay up to stainless steel. So, like I said, it's like
There are
we have
those
to,
issues as well.
the doctor
There are
to take
no right
care
or
of.
wrong answers.
Exactly, there's no right or wrong, because definitely from the patient's perspective, as a patient, if I was that patient, I would need that help,
Mm.
that oxygen mask, that IV cannula. If I'm that doctor and I know that patient's got a very high chance of having COVID-19, do I want to touch that patient?
Mm.
It's very, like you said, no right or no wrong. It's
Mm.
ethics comes into question over here.
It's a
as
grey
well.
area
Very-
as well.
Very grey.
And like
So
we've-
in this
sorry.
perspective, what I can say that the hospitals authority who are running the hospitals, they should be more aware and more
Vigilant.
alert
Yeah.
to provide the PPE, personal protective equipment, for
Right.
their healthcare
that is a
providers.
very very good point.
Because
Actually.
if the healthcare providers are becoming ill in a great,
Then who will take care
larger
of it?
number, then
Yeah.
who are going to take care?
That
So
is true.
their protection is also very, very important, and the hospital authority can
Really
provide the.
So I'll play a bit of devil's advocate over here,
Yeah, I know.
which I usually do. So, to stay clean, to keep a good working environment costs money,
Right.
right? We are a developing health economy. We are not a developed health economy. And even in the most developed health economies, it's not. I mean, for me, working at Queen's in London, still there are a lot of shortfalls,
Mm.
right? So, the bottom line is there is a cost.
Yes.
Right, so what we need to see, not just ourselves as patients, but as healthcare providers, what is the cost we're willing to pay?
Mm.
Is it in terms of finances? Is it in terms of a financial loss for maybe a year? Or is it in terms of lives of patients?
Right. So I think we've come to a almost end of this discussion, but we're leaving with lots more questions. I think
Exactly.
that's actually a good thing, because the more we ask questions, the more we get the right answers. But I'd just like to end on a very basic question related to prevention and treatment. Hand sanitizer or hand washing? What would you say is better?
Me, hand washing
You?
with soap.
With soap.
Hand washing with soap.
I'm also hand washing with soap, yeah.
Okay. I mean, I also
That's
think
the best.
That's the best,
ideal,
and
And
right.
probably the cheapest soap
Yeah.
available.
yeah. I mean, as long as you're washing your hand is
Yeah,
what
so
the
the
main.
reason I say cheapest soap, because soap is made with alkalis.
Right.
So the alkalis is relatively raw in the cheapest soap.
Meaning
Oh,
the
okay, so
clothes
it's
washing
actually-
soaps actually
okay,
have
more
more
effective in a way.
more
So not
effective.
your cosmetic soaps. I'm not going to mention any brand
Not the
names.
beauty soaps or the fragrant cosmetic.
Right,
but
that's very
basically
that's very interesting.
clothes washing soaps are
Okay.
actually found to be most caustic.
That's a very interesting point. And lastly, what would you say are some of the basic medicines to manage any viral flu?
So we've touched on this. We've spoken about paracetamol.
Right.
Again, from me coming from a UK context and seeing patients in Bangladesh taking only one paracetamol, which is 500 milligrams, will do nothing.
Okay, it won't do much.
It won't do.
For
it's
an
not
adult, we're
It's
talking
not
about
an adult.
adults.
Okay.
Yeah.
So
Okay.
when we talk about adults, again, the thing that we need to consider is maybe a 60 to 70 kilogram individual.
Right.
So for a 60 to 70 kilogram individual, it's 2 tablets,
Hmm.
3 to 4 times a day. That's 6 to 8 hourly.
That frequently you need to have.
Yeah.
Okay.
Right? Whether you
Because
have the
it's
fever,
the fever
or
and
not.
the body ache. It's
Okay.
tackling both.
So whether you
Aches
have a
and pains
fever
of
or not, you don't wait for the fever to come.
You just
Once
keep
you
on
have the fever,
taking it.
you run through it. So that breaks the pattern of the fever.
Mhm.
For granted, there are people in Bangladesh who are adults who weigh well under about 50 kilograms, 40 kilograms.
Mhm.
Then we adjust the dose, maybe 1.5
Right.
tablets. That's paracetamol. Then there's antihistamines
Antihistamines
of whatever variety
yeah.
you need. You can have the once daily ones, you can have the 3 times daily ones, you can have the ones that make you drowsy. There are the non-drowsy ones, your personal preference.
Okay.
Anti-ulcerants.
Anti-ulcerants, if
Yeah.
you, it's a time
I'd
of
say
stress.
I'd say during times of stress you just take anti-ulcerants
Yeah.
anyway.
Okay.
So a fever is a stressful.
Hmm.
I'd probably
Thing
be a
on your
little
body.
bit different because people in Bangladesh take anti-ulcerants.
A lot.
Yeah, so that's why I said that just for that duration. I mean,
People
you
tend
don't
to take a lot of
continue it
anti-ulcerants.
months after months.
Uh,
Right.
The
That
other
is
thing-
just for others who don't know. It's for related
Yeah,
to
so
What
it's,
we
digestion.
say gastric,
gastric.
So
loosely, but
the
we say
medication
it's
that we
like
call omeprazole, esomeprazole,
Right.
pantoprazole,
Right.
that's the generic names,
Right.
whatever trade names that you might be buying them in. There has been advice on non-steroidal anti-inflammatories.
Yes.
Against.
Yeah,
Against.
about not
Again,
taking them.
ibuprofen, yeah.
Ibuprofen.
So
Yeah, been told not to.
ibuprofen, naproxen, diclofenac, mefenamic acid,
Yes. I mean,
these to be avoided.
To be avoided.
Again, the evidence and the literature isn't there right now.
Mhm.
It's still
we
evolving,
we
yeah.
might be going back to, yeah, you can take it, or no, avoid them.
Currently, we don't have enough evidence
Yeah,
to
we
go.
don't have that. I would also say fluids. Now, fluids could be just plain water, or it could be your Orsaline if you're having a lot of runny nose,
Mm.
because with secretions you lose salts.
Mhm.
So main thing would be water, and then you can have other symptomatic treatments like if you've got a blocked nose.
all other kind of symptomatic things
Right.
like that then. But these are the basic. you know,
Right. I think I really appreciate all of you giving so much time and answering some really critical and key questions. And with that, I'd like to end and thank you.
You're most
Thank you so
welcome.
much.
Thank you for having
Other
us, yeah.
questions? Yes.
Well, thank you.